I'm gonna be palpating the spine. First, I want to determine where the pain is exactly located. So I'm going to start palpating along your spine and just let me know where does it hurt and where does it stop hurting. Does this feel painful?
A little bit, not really.
Okay. Just let me know where it starts to feel
Okay.
a bit painful.
All right, there.
Kind of here? Okay. I'll be marking your back just to have a guide. Okay. As I'm moving down your spine, do you feel the pain increasing or decreasing?
I'm still feeling it a little, but it's decreasing as you're going lower.
Okay. Okay, let me know where you stop feeling pain.
No more pain. It stopped.
Okay, I'm gonna keep moving down the spine. Let me know if there's any pain anywhere else. Okay. Okay, I'm gonna start tracing all your vertebrae on your back. Just starting on the base of the neck. Okay. Okay. Start noticing a little bit of misalignment on the spine. Okay, definitely a little bit of scoliosis, mostly on the lower part of the back. I'm going to be taking a few measurements. want to make sure I note where the deviation starts. Okay. Okay. I have a 60-degree deviation starting on this area. Degree. Okay. And 60 degree going back. Okay. Okay, so the most affected part is the 17 centimeters on the tailbone. And 27 on the base of the neck. Do a couple other measurements here. Okay, I'm going to be taking a few measurements just to check for any asymmetry or inflammation on the back. Okay, definitely a little bit of inflammation in this area. The top part looks pretty symmetrical. Okay. Okay, so even though the misalignment and the inflammation that I feel are towards the lower back, what happens most times is that the upper back will try to compensate for the bottom. So that's where you're going to start feeling the pain because it's just causing too much strain on the rest of the spine. Okay. Okay, I'm going to be tapping on along your spine. Just let me know if you feel any shooting pain, any maybe a tingling or a numbing sensation, anything that feels abnormal to you.
Some tingling
Around here. Okay, so this is pretty consistent with the area where we're experiencing pain. Does it continue?
No.
No, okay. Any more pain on the lower back?
No.
Okay, I'm going to be taking the temperature of the back. I just want to make sure I don't notice any abnormal temperature variances. Okay, everything's within 0.5 degrees Fahrenheit, so that's normal variation. I'm go ahead and switch my gloves. Okay, I'm going to go ahead and do a couple neurological tests on your back. First, I'm going to be doing a sharp or dull sensations test. I'm going to be using an object that's going to feel sharp and an object that's going to feel dull. So this is going to feel dull and this is going to feel sharp. Did you feel those?
Yes.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. Sharp.
Okay, I'm going to make a little mark in here. Do you feel this?
Dull. Sharp. 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 dull, 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 dull.
So I notice a little bit of loss of sensitivity on this part right here. I'll do a couple other tests. Okay, now we're going to be trying with two objects that are the same. I'm going to be applying pressure with either one or both of them. So you can just say one or two depending on how many pressure points you feel. So that would be one. This would be two. Okay?
Okay. 1, 2,
Okay.
2, 1, 1, 2, 1, 1, 2, 2, 2, 2, 2, 2, 1, 1, 1, 2, 2, 2, 2, 1, 2.
Okay, now I'm going to be sliding either warm object like this one or a cold object like this one. Just going to slide that on your back. Now I want you to tell me if it feels cold or warm.
Cold, warm, warm, cold, cold, warm, 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 cold, cold, warm. Both.
Okay, perfect. Okay. So now I'm going to be drawing some different letters on your back, and I want you to tell me if you can recognize which letter I'm drawing. Okay.
H.
Okay. Could be numbers as well. This is going to be a number.
9.
Okay.
Nine.
Okay.
G.
Okay.
A.
Okay.
D.
Okay.
B.
Okay.
Zero.
Okay.
Two.
Okay.
I or 1.
Okay, perfect.
5.
Okay.
3.
Yes.
Seven.
Okay, great. Okay, so that was all very good. Neurological. I don't see any issues stemming from the misaligned spine. So that's great news. Okay, so I'm going to be doing a little bit of therapy to help reduce some of the inflammation. Okay. Okay, I'm going to be applying a little bit of oil just to help us provide some protection on the skin. So we are massaging the back. I'm going to start massaging gently. Whoops. There. Okay, I'm going to be using a cupping tool to be able to get a little bit deeper the muscle tissue and try to work out that inflammation. I'm going to use this cold objects to massage the back, trying to help with some of that inflammation. Okay, I'm going to be applying a little bit of pressure. We're applying a pinching motion, trying to work out any knots and just help any fluid drain into your lymphatic system. I'm going to proceed to just wipe off some of that oil. Okay. I'll be doing a little bit of skin pulling therapy. So I'm just going to be pulling on the skin. It shouldn't hurt. It's going to feel like a little bit of a pinching. Shouldn't really hurt. Okay, Metaxia, I think we're done for today. You should start feeling a lot better in the next couple of hours and over the next couple of days. And I think the pain is going to be reduced a lot. It might still be there a little bit due to the pronounced scoliosis on your spine. So that would need a few different sessions to be able to treat that. So I would really like to see you again and do a little bit more therapy. I would say maybe once a week for the next month, and then we can see how you're doing then.
Okay. Sounds good.
Okay.
Thank you.